Hello, friends. I'm a doctor by profession, and Balasubramanian is my name. In the first year, a basic understanding of the human body, anatomy, physiology, biochemistry, paramedical people need to know. So this video, an introduction, what is the real problem? What are the barriers the students face? Learning is a process. There is no age limit for learning, and there is no end for learning. If you spend just 1 hour to improve your knowledge within a matter of just months, you will definitely be confident of doing your duty. It's not just getting a degree and getting an appointment, facing an interview, a job, the routine work. For some, it may be okay. For people who really want to know things, who wants to update knowledge. So this video is not only for nurses, it is for everyone, physiotherapists, BPT students who are studying, who have completed their course, and who are practicing, and who are employed, all these people. If they want to know, nobody will restrict them. So now, what are the usual barriers a student faces when he is in a college? The time and duration. There is no separate physiology for nurses, separate physiology for doctors. All the subjects, anatomy, physiology, biochemistry, pathology, and you cannot say this is enough for you. As far as subject is concerned, nothing is enough actually, because you cannot blindly follow things. You will try to reason out. For that you need time. So this time duration given for you and for the staffs who are taking the classes is very limited in hours. A medical student goes to the practical class, goes to the theory class repeatedly. The same theory is taught again in the practical class. So he gets more time, more exposure, more staffs. Different staffs take different subjects, different topics. He spends about 1 year to learn the same subject, which nurses and physiotherapists are given only hours. I don't blame the system, but they have to complete all those things. Same time, students are burdened with a lot of subjects, assignments, visiting hospitals, standing for a long time, taking care of patients, and coming back to the theory class, sitting in the class. They don't even find time to take food. I have seen this. So this is one aspect, time and duration. And the student as well as the staffs, they teach people to get a pass. So getting a degree, getting a pass, that's all. If you take 50%, then you will pass the exam. But remember, when you come out, a patient comes to you, if you treat him only 50%, because you got only 50% marks, is it enough? That is why we don't have choice in professional colleges. You don't have choice in life. So there is no choice in a professional college, but 50% mark is enough, you get a pass. And now what happens? You come out of the college with only 50% confidence, 50% knowledge. Completing a course is different, but learning is different. You scored 50%, now the other 50%, even after coming out of the college, try to learn. Well, let us fill that 50% also so that you will be confident and you will have adequate knowledge to face any situation or emergency. What is the next barrier in learning in a paramedical college? The very important barrier is language. Remember one thing, India has got a lot of states, every state has got its own language. Imagine every state starts teaching in their own language. It's okay. But remember, the very first thing you should remember is you are going to write the exam in only one language, English. So what is wrong in learning English? One. Second, if you are taught only in Tamil or Malayalam or Telugu, your knowledge will be restricted only to your state where you live. If you go to other state, you will find difficult. You will face a lot of patients. Every patient has got their own language. They will try to talk in their language. You cannot learn all the language. So there must be a language which most of the people talk. At least if the patient is not talking in English or any language, at least the attender can talk so that the understanding will be good. So I won't say that English is superior or other languages inferior. It is not like that. If you get an opportunity outside, a job opportunity, you are going to some other countries, then you may need a communication. This communication gap should not be there. Language should never be a barrier because for a professional student, grammatical language is not very much needed. I know you are all able to understand what I talk, but you are not able to repeat it. That is your problem. Why don't you learn that? There must be a common language. I will read. All these subjects you never learned from your 5th standard or 6th standard or something like that. You have just come, very recently you come to these colleges. All the subjects are new, but you start learning the subject. Same thing, the English is taught from your childhood. It's not new, like the subject. Now why don't you learn English? The level of English need not be like an orator. You are not going for any competition. What you feel, what you know, you are going to write. And when your paper is corrected, we don't look for grammars. We look for only points. If that point is there, even though if you don't know how to construct a sentence, we can easily assess that this person knows the topic. He knows the answer. So we should give him mark. So don't worry about language. This is first barrier in any colleges for that. It is paramedical or even medical colleges who are taught in different languages. When they come to a medical college, they are supposed to learn through English because only English is a language for writing your examinations. That is important. And another thing is all the books are written only in English. Most of the authors are English authors. We have Indian authors. Of course, even these Indian authors, they write book in English, but the standard of English they bring to our level. Simple language, simple sentences, simple words. This is how Indian authors write books. But whatever it may be, the book is written only in English. If you take the role of staffs in language, first thing, give them confidence. It's nothing. Don't worry. You can learn it. I will teach you in a simple language. I won't use a complicated sentence, a complex sentences. No. Simple sentences. And one more thing. Whenever a person doesn't know what I'm talking or what is the meaning of that particular sentence, please allow them to ask doubts. Let them stand up and say, I don't understand this sentence, sir or madam, whatever it may be. Allow them. Give the freedom. That's the role of staff here. The next barrier is books. You have one subject plus 2, 12th standard. For all this, you have only one small book, about 100 to 200 pages. In 1 year, this book is read by you many times, many exams. You are supposed to read one book and reproduce whatever you learned from that book. You will get good marks. But once you enter into your professional college, subject is one, but lot of authors, lot of books. Every author writes in his own way. So when you read 2 or 3 authors, then you will become another author because you will understand all these points from various authors and you will start remembering this. Another thing, when you read more books, you will select one particular book which is easy for you, which is easily understandable. And remember, all the books are written only in English, not in your local language. The next barrier is fear. Why this fear? First thing, there have been school pupils, almost children, reared by their parents, teachers, simple life. Now suddenly he becomes a student. From a school pupil, he becomes a college student. The atmosphere is different. The peer group is different. The teachers are different. The subjects are different. And now the atmosphere, the environment, everything is different for them. So what they think, Oh, this is a new place. So that fear will be there for every person who enters a new college, new place. This fear should not be there. How to do this? Only staffs. You need not be friends. You can be friendly to them. Talk to them. Apart from the class hours, make them confident. After all teachers, you and me, were once students only. We know how we suffered, how many types of teachers we faced. Every teacher was different. Sometimes you start liking one particular staff because he approaches you in an emotional manner. A patient listening is one of the good character of a nurse and a doctor. We doctors and nursing staffs, don't you think you need to hear their problems, their understanding capacity, their difficulties, their emotional disturbances, all these, try to talk to them and get those from them. Next barrier is distraction. I don't think I should spend much time on this because we have a lot of distractions. They are all adolescents in age group 17, 16, 18 in that group. I won't say immature, but they are getting matured slowly. So at that time, priorities, what is important, what is not important, how much to entertainment, how much to education, these they are not able to calculate properly, or there's a limit for everything. They don't know how to limit this. We spend a lot of time for entertainment, especially social medias. I won't say social medias are wrong. Really, I learned a lot from social media. Forwarded messages. Many of the messages are subject matters only. You restrict yourself. Leave away those other unnecessary talks. But we need entertainment also because that is the relaxation we get in between. So give time for each. You are distracted by many things, which is going to give you a degree, which is going to give you a job. Is it entertainment and distractions or your degree? Recognition. How you are going to get recognized as a nurse, as a doctor, as a physiotherapist. Whatever you are, God has given you this chance. Do the best. We all are interdependent. So don't worry why I am a nurse, why I am a physiotherapist, why I am a doctor. This is a chance given by the God to you. And don't make the God regret why I made this man as a doctor, nurse, and physiotherapist. Do it. Success is not by accident or luck. It's only by hard work. And we people do not need much of intelligence. We need only hard work. All the subjects are written by somebody. We are going to read that and reproduce that. For that, no need for intelligence. But when you come out of college, when you are going for a job, acting as a doctor, as a nurse, as a physiotherapist, application of knowledge, what all you gain in the college, that needs intelligence. So during studies, you don't need intelligence, but after studies, you need intelligence. Hard work during college, smart work during practice, and intelligent work during practice. You will shine. You will be known as the best, at least one of the best doctors, one of the best nurses, like that. And never think this is enough. Never get satisfied with the knowledge you are having, because it's an endless process. Crave for more and more knowledge. And another important, very important point is, who has sent you this college, to this course? Your parents, your family members, they are all having high hopes on you. So never forget that with what all the hurdles and what background you have come and what expectation your parents have, you are going to earn based on your qualification. When you go for an interview, one thing is a simple thing, remember. There is something called educational qualification. BSc Nursing, BPT, MPT, MSc Nursing. These are all educational qualification. But among the hundreds and thousands of this BSc, MSc, BPT, MPT, all these people, why should we conduct interview? For simple one reason. The qualification is equal for all of you. How you are going to use that qualification? One. Second, what are your qualities? These two things we are going to assess during interview. That is why we give you a situation and we ask you, what will you do? Now, you bring back all your knowledge, all you studied in the college days, assemble everything, form an answer, and answer us. If the answer is satisfied, you are selected. You are not selected by the qualification, but you are selected by the application of your mind based on your qualification. Is it not wonderful? With all this in mind, can we start to learn more? I don't say just because I'm talking to you that I know everything. Nobody knows everything. If I say I know everything, I don't know what is everything. I feel as a doctor, as a person who's got a passion for teaching, I think I know a little bit more than what you know. That more I am going to share. Now what happens? We are balanced. So what all extra knowledge I have, I am giving it to you. Take it from me. Benefit out of it. Be a good nurse or a good physiotherapist. And let us travel together because medical field is interdependent. My profession is not fulfilled without you. Can we start? Can we travel together? What all you know, tell me. I will learn from you. What all I know, I will tell you. You learn. Let us share everything. And this is the purpose of this channel. Thank you.